Hi everyone. So I would like to just give a communication OSCE tip to all the candidates um, because I've been working in Australia for a long time, and there are certain ways that we do things here that are not done in most of the other countries, and because you are going for the practical exam, they want you to follow the standards which are followed in Australia and how they do things here. So one of the important thing that I want to mention, of course, there are a lot of videos that we already have in the course regarding different regarding different cases. We have discussed them. We have files, we have videos, we have tips and tricks. But one thing that I have noticed after having so many sessions with candidates, after conducting the communication OSCE mock exams, is that please remember whenever you are doing a communication OSCE case, please treat or manage the patient. Don't only manage the condition that they're coming to you for. All right? That's something that you need to remember because when we have these sessions, when we have these mocks with candidates, and also when they appear for the practical exam and then they fail, one thing that I have noticed is that the candidates have the habit of jumping towards the patient's problem, the patient's condition. Of course, that needs to be taken care of. You cannot just avoid or neglect the reason why the patient is there at your clinic or practice. Of course, that's something that needs to be done. But there are certain other things that you can do to improve your score, to keep the patient or the examiner involved when you're having the 10 minutes of presentation of the case, because it makes a lot of difference on how the examiner perceive your case and how the examiner marks you. So always remember that when you have a case, always try to manage the patient as a whole, making sure to understand the patient conditions, the patient circumstances on which they are here at your practice today. Now, what I mean by that is that you see, whenever the ADC gives you a communication OSCE case, they don't only give you the patient's chief complaint, they give you certain extra information as well, because every case is quite lengthy, right? Which you are going to read for 3 minutes and then present the case. So every case is quite lengthy. So make sure that you extract as much information as possible from the case, because there is a reason why ADC is giving you that information in the case. It's not just telling you patient, let's say patient XYZ is coming to you with pain. They don't just say they are coming to you with pain, manage the condition, so and so. They give you X-ray clinical picture. No, they give you some prior information. They give you certain information in regards to the patient's background, patient's personal circumstances, and things like that, which is given to you for a reason. Otherwise, there would be no point for you to have that information given to you in the case form, right? There is a reason why those sentences, why those words are included in the case data that you have on the screen on the day of the exam. Now, what I mean by that information is, for example, you have a patient coming to you. He is complaining of, let's say, any problem, let's say mouth ulcers, all right, aphthous ulcers, let's say. He is a university student. They include the term, he is a university student. He is a law student. Now, why is this terminology included? They could have just said that patient, let's say XYZ, came to you with mouth ulcers. But why are they giving you this background information? Because they want you to interact with the patient, involve the patient in the discussion. How? You will be saying, I can see that you are a university student. How is it going? How are the studies going? Are you under any kind of stress? How are you finding Australia so far? Let's say if he's an overseas student who just came to Australia to study. These questions are very important because it shows your interest in the patient and understanding the patient's circumstances, and making sure that the patient responds to you so that it becomes a two-way discussion rather than a speech. Then, of course, you have certain cases where you will see the patient is new to Australia. Then certain questions become important. How are you finding Australia so far? Have you got a place? Where do you stay? Things like that. Where do you work? Because these questions starts to develop a rapport with the patient. They are so important. They are very important for communication. ADC examiners love these statements, love these dialogues when you have them with the patient. All right. Certain cases will tell you, let's say, the patient is having some financial limitations. You can ask the patient, how are you coping with things? Do you currently work? How are your financial situations right now? Because the case might tell you the patient didn't go for any treatment in the past because they had certain financial troubles. If the patient, let's say, the case tells you the patient had a new job, you can tell the patient, congratulations, I can see from the information that you got a new job. How are things so far? Are you enjoying it? Just a brief statement like this makes a lot of difference. For example, before coming to you, the patient went to a medical practitioner, his GP. You ask questions. What was the reason for that visit? What discussion did you have with the GP? Did he prescribe you with any medications? You see, just to keep and the case interesting and keeping the patient involved. These statements, although look very small or very little, but it makes a huge difference to how the examiner perceives the case and starts scoring or gives you score for the case. So please make sure that when you have such information in the case, include that in your discussion. And I'm telling you, we love these candidates. When the candidates do that, it makes a lot of difference. And clinically, like I'm a practicing dentist in Australia, it makes a lot of difference to the patient as well. They feel involved, they feel taken care of, they feel there is someone listening to them, they feel there is someone understanding their situation, empathy towards them. It makes a lot of difference, and that's what the ADC wants you to replicate on the day of the exam, because it's a simulated environment. That's what they want you to do. All right. The other thing that I want to say is that please make sure, of course, we have a lot of candidates already enrolled in our practical exam course. Make sure that you, if even if you're not enrolled, make sure that you book a communication OSCE mock exam with me for the practical exam, because what we do is we mark you on an ADC marking rubrics, 15 points for each case, and we hold these communication OSCE mock exam individually with each candidate, and we discuss 6 cases from different clusters, the 3 clusters that you're being marked on, and then the communication OSCE cluster. So make sure that you do it, because it's going to make a huge difference on how you're going to perceive. It makes a huge difference because we have seen candidates, they realize, okay, this is how the cases needs to be done. These are mistakes, my mistakes. This is how, or this is what the ADC is actually expecting from the case. So little things makes a huge difference, because every point, everything that you do in the ADC practical exam marks you towards the marking rubric. So you don't want to miss out on even the slightest of thing which can improve your score. All right. Thank you.